I'll just give it 2 minutes so that I give everybody a chance to sit together. Thank you. Sanbanani. Dumelang. Afsheni. Tobela. Okay. This is clearly not working. Can I ask you to do something? I mean, you've been in Durban for almost a week. I thought I'd get a little bit of a substantive response. So let's do a vital check. Lift up your left hand, or whatever is not your dominant hand. There we go. 2 fingers. Put them to your pulse. You feel anything? There are lots of doctors around here. I was just looking for proof of life. Sanbanani! Aha! Thank you very much. Now, Babantubam, you're alive. I'm so glad to see that and hear that. Your Excellencies, ladies and gentlemen, those of you who identify by other pronouns, welcome. I am so glad to see you all here, so many of you remaining with us. Once again, my name is Tshepiso Magwetla. I will be your Masters of Ceremonies for this closing ceremony for the 4th International Conference on Public Health in Africa, the 4th CPHIA closing ceremony. And it really has been such an awesome conference. I don't know about you. And let's just give you by the numbers again what you have been experiencing. We have had, let me see, 3 main plenaries, 8 special sessions, 20 abstract sessions, and dozens of side events, all of them as edifying as the next. You can all tell us what you experienced, but I just think that what you have all done is amazing work. I've listened to some of the discussions, and I'm going to touch here and there on some of them. But just first to thank the people who gave their generous support to make CPHIA 2025 possible. Let me acknowledge once again the United Arab Emirates government, the Mohammed bin Zayed Foundation for Humanity, Gavi, the Vaccine Alliance, the Republic of South Africa, the Africa Centers for Disease Control and Prevention, and Africa Bio. Can we please give them a warm round of applause? This has been a fantastic gathering, an absolutely fantastic gathering. And the last couple of days, we've seen the speakers explore the 3 main themes of financing the future through sustainable, innovative health investments, boosting local manufacturing of vaccines, medicines, and diagnostics, as well as transforming primary healthcare using African-led digital and community-driven solutions. And I think it's pretty fair to say that we've set the stage. We've really laid down the groundwork for the upcoming G20 Summit of Leaders that is under South Africa's presidency and leadership that takes place early in 2025. Do you agree? Surely you agree in the work that you've done, yes? Yes? Yes! Yes! G20 Ozala, yes, G20. We've done the work for you. Now it's for you to execute. We've been saying it's not about words. We want to put policy into action. And I'd like to believe that you guys have really pulled apart some of the major issues, the stickler points that you are saying to your leaders, look, here is what we're saying is important for African-led solutions. We don't need to be told what our problems are. We don't need for you to design the solutions for us. We're here, we're ready to implement. So I think it's important to just reflect on that. I just was remembering a session that I was at for WAFLAD, just some of the statistics that they were giving, that the burden of cervical cancer by 2040 is going to be quite frightful. They're saying that, Africa bears the highest threat in terms of the incidence of cervical cancer. If I'm not wrong, $10.3 billion loss of productivity if we don't step up and implement some of these solutions. And they were saying something quite important just in terms of HPV vaccinations, saying that it's time that we have not only a multi-sectoral approach, but all government departments must be included. They're speaking about the Department of Education, how they need to be brought into the fold so that we start vaccinating children as young as 14, but I believe it's 9. And we know that there are a lot of cultural barriers that we sometimes face, religious barriers in some cases, that a father would say, why are you taking my child to a clinic to be vaccinated, thinking that it's pregnancy prevention, when what it is a life-saving intervention. So it is true, we need to start talking about it. Community, civic education needs to grow exponentially as we face these challenges. Minister Nzimande, who was speaking here at the BioAfrica plenary, saying the moving towards self-reliance and achieve universal health coverage and health security in Africa, that it's about transforming Africa's pharmaceutical role, saying that we're moving from being consumers to producers, that we must commit to leading with knowledge and intention. And I'd like to believe that's the overall commitment that everybody came to. So, ladies and gentlemen, without taking too much time, I'd like to invite onto stage to give a much more coherent summary of what you've heard, because there was so much more that will be given in a more eloquent manner by Professor Placide Mbala, who's the CPHIA 2025 Scientific Program Committee Co-Chair. He's going to come up and tell you what the rapporteur summary holds. So please give him a warm round of applause. This is one of the brains of this organization, the event that we saw. Another round of applause, a much rowdier one. Hard work went into this.
Thank you so much for this introduction. So I will guide you through the work that we conducted. As you can see, the work started just a few months ago, 2 months, as I can say, and it's a record. I think we were all very stressed, and we are glad that we made it today. So, next slide. Yeah, so just the CPHI through the years.